Your Excellencies, distinguished government representatives and ministers, respectful leaders of global organizations and agencies, dear participants of the Global Conference on Primary Health Care, good morning, ladies and gentlemen. On behalf of the government of Kazakhstan, it's my tremendous honor to welcome you in our hospitable Kazakhstan for the 40th anniversary of the Almaty Declaration on Primary Health Care. I sincerely congratulate all of you with the anniversary of the landmark Almaty Declaration that was born 40 years ago in the city of apples, Almaty. For those who wish to learn some Kazakh words, today, Alma is apple. Ata means a father. To British wisdom, an apple a day keeps the doctor away, has a direct relation to the choice of the city named Father of the Apples for the declaration that promotes health for all. We gathered here to celebrate one of the most revolutionary declarations ever adopted by countries in the spirit of Almaty in Astana, the new capital of independent Kazakhstan. After gaining independence in 1991, we had uneasy turnaround times in economic, social, and public spheres. Industries were relaunched their pipelines. The national identity was redefined, and we strived to rebuild our nation with a fresh look on development strategies. The entire economy was largely based on the Soviet budgetary planning system, was transformed into the market-based, integrated, and open economic space. As we had to overcome the challenges of the time, we managed to correct the course of development and to streamline our growth. In 2012, the President of the Republic of Kazakhstan, Nursultan Nazarbayev, announced the most recent long-term vision for country's prosperity in a strategy called Kazakhstan 2050, the new political course on an accomplishment nation in the fast-changing world. As our current overarching umbrella document for plan-standing policies for the coming 4 decades, this half-century strategy puts social protection, education, and healthcare as the top priorities of national efforts. Health is recognized as the foundation for economic prosperity. Within healthcare, at the highest political level, we put primary healthcare as the core of health system development. For example, our 4-year State Health Development Plan 2016-2019, the primary healthcare at the center of integrated and people-centered service delivery. We are transforming the single specialty hospital system to the integrated with the primary healthcare. The so-called Nations Plan, 100 steps launched by President Nazarbayev in 2015, introduced the switch from the current budgetary to social health insurance system in order to achieve universal health coverage as one of the key reform steps beginning from 2020. Kazakhstan actively supports and implements digitalization of economy, including health sector. Digitalization of healthcare started with the primary healthcare. First, mobile apps in Kazakhstan were introduced in primary healthcare. Recently, the new president's address given on October 5th highlighted the desire to increase health financing with priority on the primary healthcare again. These progressive steps helped to improve the health outcomes. In last decade, beginning from 2008 till 2017, despite modest health expenditure of around 3% of GDP, maternal mortality dropped threefold from 31 to 12 per 100,000 births. Infant mortality decreased from 21 to 8 per 1,000 live births. Tuberculosis mortality fell from the 125 cases per 100,000 population to 52. And overall, life expectancy increased from 67 years to 73. Kazakhstan is humbled and honored to be the birthplace of the first declaration that united countries from all around the globe in the reaffirming people's fundamental right to health. The merits of the inspiring declaration of Alma-Ata are indeed countless. We will share the same challenges, such as aging, non-communicable diseases, and the growing costs of the healthcare that are common for all of us. As Kazakhstan strives to modernize its economy and social sectors, we realize that sharing the path to be more efficient and effective could be rewarding. A year ago, we offered the idea of renewed look of primary healthcare. We thank all countries for supporting the initiative to develop a new declaration which will let us join efforts. Today, we gathered in Astana to redefine the global agenda of health system around the primary healthcare. I am excited to showcase our capital city, the symbol of Kazakhstan's independence, and the new course of development. We invite you all to explore our capital, which last year hosted the World Expo Future Energy Exhibition and this year celebrated its 20th anniversary. This conference brought together more than 1,200 delegates from the more than 120 countries, and fruitfully named from Alma-Ata towards universal health coverage and the sustainable development goals. As an economist, I must say that a strong case for investing into primary healthcare remains as important today as it was 40 years ago. By having a people-centered and strongly supported primary healthcare, a country can meet majority of its people's health needs throughout life course in an economically more sustainable way. We all know that prevention and early detection of a disease at the primary healthcare level costs less for the system than treatment of diseases in resource-intensive hospitals. We all must understand that was the first level of contact with the people. The strong support for primary healthcare matters for prioritization by governments and international organizations. And that is the core message of today's conference. Bold and active support for primary healthcare must be seen as the most effective and efficient approach to enhance people's health. This conference brought together a broad community of NGOs, health professional associations, and the civil society who are also key implements of primary healthcare agenda. I would also like to welcome the youth, a special participant of this conference. We embrace young people with the warmth and the care because they are our foundation today, and it's their health that will be impacted by our decisions tomorrow. I believe today and tomorrow during the conference, we will have many opportunities to discuss a variety of important issues that can take us clean and to each other and act in coordination. We are excited to deliver today the new declaration of primary healthcare in Astana that was developed with the active participation of more than 1,000 authors from around the world under the chairmanship of Kazakhstan this year. We look forward to the future that will be shaped with our wise steps today. And I hope that the declaration of primary healthcare offered for adoption today will be a foundation for build 21st century prime healthcare and a key pillar of health systems globally. As you may have seen, then landed in Astana, we have a vast land of steppes. Kazakhs say, let us elevate the esteem of the steppes without degrading the esteem of the mountains. That means, let us promote Astana without devaluating Alma-Ata. So I called all of you conference participants to have Alma-Ata in your hearts and embrace the brilliance of modern Astana in your minds when you remember Kazakhstan. I thank you, each of you, for your commitment to serve the people to better health and well-being for all. I congratulate everyone on being part of history here in Astana at this conference and wish you all the enjoyable and fulfilling stay in Kazakhstan. Thank you for your attention. Көп рахмет.